Hi, my name is Rebecca and I'm a sonographer, which is someone that performs ultrasounds. Today I'm doing a video on how to scan an aorta. First up, what is the aorta? The aorta is an artery, and arteries are basically tubes that carry blood around the body. Arteries are one part of our circulatory system, whose job it is to take blood to our bodies, and veins are the other part of the system that bring blood back to the heart. The aorta is our largest artery and it's responsible for transporting oxygenated blood to everywhere in the body. And as you can see on the diagram, it begins at our heart and ends around the belly button. Here is a simplified illustration so it is easier for us to see the aorta. The anatomy of the aorta is quite detailed as there are 4 sections and they all give rise to different branches that supply different parts of the body. Sonographers are only able to see the one section within our abdomen, so I'll focus in on that one for this video. So, you may ask yourself, why scan the aorta? The main request we get to scan the aorta is to look for an aneurysm. An aneurysm is a dilation of the aorta. A sonographer will look for enlargement of the aorta within the abdomen, and if found, this type of aneurysm is called an abdominal aortic aneurysm, or to use sonographers' terms, a AAA. Next, when do we scan the aorta? Symptoms are very minimal with AAA, so your doctor may have noticed a pulsating feeling near your belly button, or a AAA can also cause deep belly pain, but like I said, very minimal. So in this instance, if you actually had symptoms, we would do a targeted ultrasound of the aorta, which means that a sonographer will only scan just the aorta. We can monitor previously detected enlargement to check for any increase in size. It's difficult to predict if a AAA will increase rapidly or remain stable over time, so a doctor will like to keep a track of this. However, sonographers will also include the aorta in a standard abdominal ultrasound for screening. I should note here, like the number of falling confetti, there are many other pathologies that a sonographer assesses for, but in the interest of time and ease for beginners, I'm just going to concentrate on the AAA. Lastly, how do we scan the aorta? I will explain as we watch this scanning video. We begin the scan at the xiphisternum, which is the bottom part of your sternum, which is your bony chest where the ribs meet in the middle of your chest. The probe is kept in a transverse plane to the body as you slide the probe down the abdomen to where the aorta divides into a right and left iliac artery. This is around the level of the belly button. During a transverse sweep, a sonographer is assessing the aorta for size. The aorta should be decreasing in size as we scan down towards the legs. We will then turn the probe in 90 degrees, this is called a longitudinal plane, to assess the aorta. The abdominal branches of the aorta are easily seen in this plane, and I'll explain these as we see them. The first branch is the celiac axis. You can see coming off the aorta here, it's the first major branch, and this supplies blood to the stomach, liver, spleen, pancreas, esophagus, and part of the bowel. The second branch is the superior mesenteric artery, or SMA we call it. This artery supplies a lot of the bowel in our upper abdomen and pancreas as well. Then there's the renal artery branches. So one comes off the left side, one comes off the right side, and they supply the kidneys. There are other branches of the aorta, but they're not readily seen as these 3 above. The aorta then courses quite close to the skin. We call this anterior, and that really depends person to person how close it becomes. And then it divides into the left and right iliac arteries. And these arteries supply the lower limbs. We will then slide our probe back superiorly or towards the head, and that's where we'll actually take our measurement of the aorta, and we take this within around 2 centimetres of the SMA. So this is why it's very important to know the branches. We like to take it because we'll take it in uniform spot every time to check the size. And we do this to prove that it's within normal limits. You can usually see when you're looking at the aorta whether it looks a bit large, but this is just, we need measurements for our worksheets and also to supply for the radiologist. Above 3 centimetres is classed as a AAA, but if a measurement were to be above 5 centimetres, this is a surgical emergency and the sonographer would need to notify the reporting radiologist immediately. Thank you for listening to my video today. Hopefully you learned a little of the what, why, when and how of aorta ultrasounds.